Wilbarger brushing protocol.
Obviously, this is way better to do with your occupational therapist. So, like, once again, please talk to your occupational therapist. I am not one. I'm just here to show you guys what we're doing. That's all. For anybody out there that is not aware, the Wilbarger brushing protocol is a sensory brushing, deep pressure brushing, proprioceptive brushing technique that is used by occupational therapists and obviously at home by the parent for a lot of different reasons. Actually, it's used for tactile defensiveness and to help kind of like with sensory integration to build up that tolerance to tactile input. It's also used for children who are under responders, who crave tactile input. Eli is an under responder, and this actually brings him out of his own world a little bit and into what's going on around him.
Okay, all right guys, let's try this again. So anyway, I'm going to do a remake of the video for the Wilbarger brushing protocol. And we have to keep these clothes on Yaya majority of the time. So, normally when we do the Wilbarger brushing protocol, we make sure that his arms are exposed and his legs are exposed. So anyway, we're gonna start.
So the first thing we're going to go over in the video is how to do the actual deep pressure brushing process. As you can see on the papers, there are small variations to how we do it with my son for my son's needs specifically, such as brushing the palms of the hands and the bottoms of the feet. If this is something that you think could benefit your child, then you can definitely look into that. The second part of this video is going to be showing you guys how to do joint compressions, which always comes after the deep pressure brushing part of the Wilbarger brushing protocol. And the third and final part of the video are all the important details that go along with the sensory brushing program so that it can be done successfully.
You take a brush, which I will specify the kind of brush in the video. Yeah. We'll start with this arm, and you will start from the top of the shoulder and brush down gently. You want to do enough pressure though so that they bend, and I will get up close and show you what I mean in a second.
You want to make it so that there's enough pressure that the bristles go down, like so. I don't know if you can see that. Not like this, okay, because it's like tickly and scratchy. So that's number one. You want the bristles to go down. You want enough pressure so the bristles bend and not so they are straight and all scratchy and tickly and stuff like that.
You start back up at the top, go down, back up at the top, go down, and do it all the way around. You don't want to go over the same spot twice. Just do it once over and keep going around. Now that we've got his arm done, we go on his back, make a W down his back, up, down, well, let's see, down, up, yeah, and then we start on the other arm. So the same thing to the other arm as the first arm. You do not do the face, neck, chest, belly, and when you do the legs, you do not do the insides of the legs, and that's because those are sensitive areas and it can have the wrong effect that you want it to have on the sensory system. Alright, so we've got his hands, his palms, his arms, and his back done. Now we're gonna go down to his legs. Yay. So, yay. So like I said, you do not do the insides of the legs. Oof. Like the insides of the thighs right here, you don't do that. And we usually have his skin exposed, not long pants. However, I have heard of some people doing it with long pants on, so that's up to you, I guess. And now we're gonna do the other leg. Remember, do not ever do like the neck, do not ever do the face, chest, belly, or insides of the thighs. It's too sensitive. Now, we're gonna sit the brush down and we are going to do the compressions. Compressions come in sets of 10, and you pretty much do it on every joint that you just brushed. So if we start, let's start from the bottom up. So we'll do the foot. So let's do the ankles. We will take the palm of our hand, put it on the bottom of his foot, and then we will take the other hand, put it on the top of his knee, and do this. That will compress the knee and the ankle at the same time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, so now you're gonna take the palm of your hand and put it on the knee, Take the other hand, put it behind his bootay, and then you're gonna compress 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So do the same thing, repeat for the next leg. You're gonna wanna compress the ankles, knee, and the hip. So we are gonna come up here to the arms. Now, take the hand, you grab the hand, and grab the forearm, and compress 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. Now we've got the wrist compressed. We're gonna take the forearm, grab the forearm, and then grab the upper arm. And I like to kind of bend, and then I'll compress 10 times once again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And the last one's gonna be the shoulder. Bend his arm and put your hand on the bottom of his elbow. He's really fidgety. Put your hand on the back and top of his shoulder, so kind of behind his shoulder blade, and then compress. Yay! 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, so you repeat that for the other arm, and that's pretty much it. So some people will do the fingers and the toes. We don't do that. He's got some tiny fingers and toes, and he's not gonna let me do that. Just not gonna let me do it. So anyway, that is the Wilbarger brushing protocol. That's how we were taught to do it by his occupational therapist. That's how we're gonna do it. I am not sure if other occupational therapists teach it differently. Like I said, I've heard of people doing the toes and fingers. That is entirely up to you. Now, Yai, I'm sorry, bum. I gotta sit you down, bud.
Alright guys, so I want to try to fit this in here real quick. This is really important information. I showed you guys how to do everything the way that I was shown, like to a T, the way that I was shown. I am not an occupational therapist. If you have an occupational therapist, definitely conversate with them about this. Have them show you, all of the things. If you don't though, this is definitely some important information that you need to know. Another thing is you really want to start out doing this once every 2 hours while the child is awake. From what I was told, after the first 2 weeks of doing it every 2 hours while the child's awake, as time allows, that we would reassess the situation, reassess how things are going. Does he seem to do okay with time in between extending beyond the 2 hour mark? And if he does, obviously there's no reason to stop life and do this every 2 hours if he's fine doing it 2 to 3 times a day. So, things like that. One more thing, these brushes, you can either get online and spend a little bit too much money, in my opinion, buying the actual Wilbarger brushing protocol brushes. They have a handle, they have fancy colors, they look all pretty and cute. Or you can get these cheapo, maybe $1 or less surgical brushes that people use to wash their hands for surgery. I get these for free at my occupational therapy clinic. Ask your occupational therapist. You should be able to get them for free. I don't know you. I don't know your therapist. I take that back. Gone. Just look for the cheap ones, in my opinion, or the expensive ones. I don't know your life. I don't know your finances. Me, I'm broke. I buy cheap things.